This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. And we've got a pair of guests this morning. In fact, we've got first-time guests. Bethany Reed is an occupational therapist, and also we have with us Amy Unger, a speech-language pathologist. First of all, Bethany, good morning to you.
Hi, good morning.
And Amy, good morning.
Hi, good morning.
Since you're both first-timers, let's learn a little something about you. Let's start with Bethany. Where are you from, and what's your educational background?
I'm Bethany. I'm from Bridgeport, West Virginia. I'm an occupational therapist with 7 years of pediatric experience. I earned my master's in occupational therapy from WVU in 2018, and I spent several years working in the public school system before joining the team at Broaddus Hospital. My background also includes working in acute care, inpatient rehab, and skilled nursing, and I am thrilled to now offer pediatric OT services to families in Barbour County and surrounding areas.
All right, so you're in Barbour County, and Amy, I understand you're a Barbour County native, correct?
I sure am. I'm a Crosville Barbour alum. I am a state and nationally certified speech-language pathologist. I graduated from WVU with my bachelor's in speech pathology and audiology in 2003 and completed my master's degree in 2005, and I actually started my career in the public school system. I have almost 20 years of combined experience in the schools and medical settings. I am so excited to now offer pediatric speech services in our newly expanded clinic space, especially right here in my hometown of Philly.
All right, so Vandalia Health Broaddus Hospital, that's where each of you work out of. And Amy, just to follow up quickly for you there, you said you worked in the public school system for 20 years. What drew you to Vandalia Health and to the facility there at Broaddus Hospital? What's that opportunity been like for you?
So the combined 20 years experience has been between medical settings and in the public school system. So that is combined kind of back and forth. The biggest thing for me is that I really love pediatrics. I've always enjoyed working with pediatrics. That's why I went into speech therapy. I have been a pretty key part of the hospital's outpatient speech therapy program for a while. We did not have the clinic space available until recently, and we're so excited now that we were able to expand that space, especially for the pediatric gym for occupational and physical therapies. That has been super, super great just to have that.
So it's it's gratifying to work with children, young people. Bethany, what's that experience like? Obviously, it's something that you've really enjoyed, and throughout your career, you've worked with children.
Yes, I love working with children. I love watching them achieve their goals for the first time. It's so exciting to be able to celebrate them. Every single day is different. You never know what you're walking into, and it's always so exciting just to get to see them and watch them grow.
All right, let's talk about the services provided there for the youngsters at Vandalia Health Broaddus Hospital. Bethany, again, as an occupational therapist, what are some of the areas that you work with these young folks and trying to learn and get better at, some of the skills that maybe they need help with?
Yeah, so we help children build independence in daily activities such as dressing, handwriting, feeding, coordination, and play, and we address motor, sensory, and cognitive skills.
And again, who maybe are some of the candidates that you see that may need some help with physical therapy? What are some of the challenges that present to you?
We see children with a variety of diagnoses and conditions. That includes autism, ADHD, sensory processing issues, Down syndrome, cerebral palsy, speech and language delays.
Okay.
So many children are candidates for occupational therapy in this setting.
You mentioned the sensory issues. Explain that a little bit to those who may not know exactly what you're talking about.
Okay, so sensory processing disorder is the way that we are able to process the world, essentially, that falls into several categories. I may not be able to list them all off the top of my head. We have our proprioceptive, vestibular, olfactory, tactile. I'm going to stop there.
Yeah.
But basically, if those senses are not regulated, we're not able to adequately perform. And if our basic needs aren't met, such as our sensory processing abilities, we're not able to adequately function in order to do the tasks at hand, so to be able to perform our daily living tasks. So you might see in a kid who is seeking proprioceptive input that they're really, wanting to crash into objects, or they're, really having a hard time regulating themselves during meltdowns. You might see that kids are wanting to jump a lot more than their peers, or that they might be overreacting to sounds in a loud environment, and that they are just withdrawing or having big meltdowns because they just cannot process all of the input that they're being provided with.
Very interesting, and obviously that's one of your specialties. That's one of the areas you can help. Amy, same question for you in terms of who may be seeking your help as a speech language pathologist.
So we work with a variety of diagnoses and conditions very similar to Bethany. We typically work with children that have global or developmental delays. We have a variety of children that have genetic disorders. We have children that just have difficulty with articulation or a speech intelligibility issue, but speech actually also works on swallowing and oral motor skills. And a lot of people know that we do offer pediatric feeding and swallow therapy. I feel like that there is a huge need for that in our area, and we take children of all ages. We take them even when they're itty bitty, even when they're babies, and we see them. I mean, we do see adults too. But we have really been trying to develop our program up here for the pediatrics and give them a place where they can come for services.
Yeah, that's fantastic to have those services at your facility, right? Because a lot of people maybe have had to travel distances before the emphasis put on these types of procedures there at Broaddus Hospital. So, Amy, talk about that a little bit, the fact that you're trying to be where the people are, right? So they don't have to travel long distances.
Absolutely. That's been such a needed part in our area for such a long time, especially now that we have the space for our pediatrics. They have a separate gym space. They have separate treatment areas from our adults, which makes it a safe environment for everyone. It makes it easier for our patients to transition between therapy to therapy. Bethany and I work really well together with transitioning kiddos that need occupational therapy and speech therapy services. We also are really just starting in the pediatric realm with physical therapy, but we also offer that service as well. We just really like to offer a variety of treatment approaches that can now be offered in our local area, where families are not having to travel to outside the county for services when they're available right here.
Before we take our first break, how can people get a hold of you? Where would you, what's the process in terms of getting a hold with you, getting a consultation, and I guess getting that insurance checked? Which one of you would like to take that on? How do you get a hold of you? How do you get an appointment set?
Absolutely. If you have questions or you want to schedule an appointment at our facility, you can call Vandalia Health Broaddus Total Therapy Center at 457-8585. And if you think your child needs speech or occupational therapy, your first step is actually to talk to your pediatrician. So we will need a signed physician's order for an evaluation or treatment. And after we receive that, we work with the parents to establish the time of day that works best for them, whether that's morning or later in the day. We do take our last appointment around 5:15, so we do the best that we can to try to get our after-school kiddos in there, as well as some people that prefer earlier appointments.
All right, so get that referral from the pediatrician, and then the number there at Vandalia Health Broaddus Hospital, 457-8585. We are visiting with Bethany Reed, occupational therapist, and also Amy Unger. And Amy is a speech language pathologist, and they work together at Vandalia Health Broaddus Hospital. We'll take a quick break. We'll continue the conversation in a moment. Stay with us. Mon Health Talk will be right back after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. We are visiting with Bethany Reed, occupational therapist, and also Amy Unger, speech language pathologist. And again, they both work out of Vandalia Health Broaddus Hospital, and you can reach them, the Vandalia Health Broaddus Total Therapy Center at 304-457-8585. Okay, let's resume the conversation here with you, Bethany. And okay, you see a child who presents with one of the with one of the situations you talked about there before the break, and you meet with them and the child's parents, and you evaluate them. So what are you looking for? I know every case is different, but what goes on in the initial evaluation?
Okay, so typically I'll gather the child's medical history, and the caregiver, I heavily rely upon their input, what they're seeing at home, and maybe if they're school age, what they're seeing in the schools. I typically do a standardized assessment. My favorite right now is the Bury VMI, and that assesses motor skills, coordination, and visual perception skills. And then I typically do functional tasks such as puzzles, clothing fasteners, writing, and gross motor abilities to determine the root of any delays. Those delays could be related to inability to cross midline. It could be reflexes that have not integrated, or that means have not gone away. That could be difficulties with visual tracking or convergence, or just fine motor coordination deficits, and that can be related to overall weakness. So those are the things that I'm typically looking for in an evaluation.
Okay. Amy, same situation there for speech evaluations. What is your process like?
Absolutely. For speech evaluations, we typically begin with a child's history and the reason for the referral. The speech umbrella is a pretty broad area. We use standardized assessments to evaluate speech language, communication, oral motor skills, and swallowing if needed. A lot of that just depends on what the referral is for and what the issues that they are currently having or that they need help with. We do see children that have issues with fluency or stuttering. We treat voice, speech and language delays, articulation issues, oral motor problems or leg problems with the tongue, the lips, jaw strength, and swallowing or feeding, and that includes like texture aversions and those kinds of things.
Right. Okay, so I would imagine that you, working as a team, as a duo there, you see children that maybe need both the occupational therapy and the speech therapy. So how does that work?
So yes, we do see many kids who qualify for both services. If they do qualify for both OT and speech, we're able to provide those services either in separate sessions or as a co-treatment if the child is not able to tolerate two different sessions and concurrently.
So I would imagine that most parents know if their children have issues. Do you is there certain situations where a teacher of a student or someone in a school or a facility may recommend a child for services?
We work really closely with several other therapists in the counties, and a teacher typically will bring it up to a parent first, and the parent usually reaches out to us. They can call us anytime without a physician's order just to talk to us and kind of get an idea of what's going on, or if they have questions. We're always happy to take a phone call and kind of get the ball rolling for them. We often call doctors' offices too and try to help with the referral process, especially if they've recently been to a pediatrician or if they've recently been to a provider and they have questions. We try to follow up with that. So it is kind of like that team approach. They absolutely can get school, speech, or occupational therapy and outpatient services if they qualify.
All right. So again, that number 304-457-8585, Vandalia Health Broaddus Total Therapy Center. And before we wrap this up, I'd like to get from each of you, if I could, kind of an anecdotal example of how your particular therapy has helped a young person or a child. Bethany, let's start with you. Can you come up with an example of a recent example of somebody who's really benefited by your services there?
I've had really positive experiences from many of my children here. One child, an example, did not attend school until he was entering the first grade. And with that, he did not have the background of being able to write. He was lacking in a lot of the social areas, being able to communicate effectively with peers, and just knowing how to build those social relationships. So we really worked hard before he entered school to develop his pencil grasp and to be able to form letters so that he could enter school at an appropriate level. And he has made so much progress, and he is just about ready for discharge. But he has really achieved his goals rapidly, and I think the support of occupational therapy really helped him to be successful in the schools.
Wow, that's outstanding, and obviously you must be proud, and the parents as well, no doubt. Amy, how about you? How about an anecdotal example there?
I can think of one little kiddo in particular who was completely feeding tube fed when they were first referred to me. This little girl, she had issues from an infant. Came to me just feeding tube fed, and she did the therapy. Her parents worked diligently with her as well, and she ended up, being discharged from therapy just back to school-based services, with eating well, eating regular foods, drinking by mouth. It was such a great and just heartwarming experience that I was a small part of that success for that little girl. I think about her often. I really do. I think about her all the time, and I'm hopeful that, she's thriving and doing well, and, that her parents are happy that, she's able to eat by mouth and just participate in really that social aspect of our world.
Yeah, very good. Outstanding. Again, Vandalia Health Broaddus Hospital. We've talked specifically about occupational therapy and also speech therapy, speech language therapy for the pediatric set, the young kids. Real quick, guys, what other services are offered there? Give us a little rundown on what Vandalia Health Broaddus Hospital is all about.
So in addition to occupational therapy and speech, we also offer pediatric physical therapy. That's a growing part of our program, and we're hoping to expand it soon. We also do have an inpatient unit at this facility. It's called a swing bed. So we offer some acute services as well as intensive inpatient rehab. We also have a skilled nursing facility where we have long-term care patients, but we also receive skilled patients where they receive intensive therapy as well.
That's a pretty good list, though. Amy, anything you can add to that?
Our outpatient center, really we have it divided into two separate almost spaces now where our adults come for a variety of reasons, and our children can receive the services, in the separate clinic space. It really is, we offer a little bit of everything from acute services to skilled nursing to outpatient therapy. Even our graduate students that come from the university or other places, they always tell us what a great experience it is to be able to see the different ways that speech therapy or occupational therapy has to offer, or the different, really, what am I looking for, the different environments that they can see while they're here.
All right, outstanding. Great information. We certainly appreciate your time, and we appreciate the great work you're doing there in pediatrics. And again, you can reach Vandalia Health's Broaddus Total Therapy Center at 304-457-8585. Bethany Reed, occupational therapist, has been with us, and also Amy Unger. She's a state-licensed, nationally certified speech language pathologist. And great job, first time on the program. We really appreciate it, and good luck.
Thank you. Thank you so much.
All right, so Amy and Bethany there on Mon Health for this Monday morning, again doing a great job breaking down the services offered by Vandalia Health Broaddus Hospital And one more time, the number for that Vandalia Health Broaddus Total Therapy Center, 304-457-8585. That's Mon Health for Mon Health Talk for this Monday. Thanks for joining us. Stay with us. The news is coming up next right here on 104.5 FM, 1440 AM, WAJR.